Grey County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome two guests to our program. Jason Weppler, who is the health promoter. Jason, you'll have to tell me if your title has changed, but right now I know you as a health promoter at the Grey Bruce Health Unit. And I have Doug Kennedy, who's joining us to share with us his volunteer experience in the Hockey Hub at the immunization clinic. So thank you both for being on the program today. I know that, Jason, you've sent me some information, and certainly I'll be most interested in knowing the amount of hours and all of the contributions our volunteers have made to the Hockey Hub model. So thank you both. Who'd like to go first?
I can start, Carol, and I will revise my title. I'm a program manager now with the Grey Bruce Health Unit.
I wondered if there'd be a change because things are changing all the time these days. And so congratulations, you. I'll write that down. Program manager. Great. Thank you. And the program itself, Jason, what's under your portfolio?
I am currently managing our oral health program and our chronic disease and injury prevention program as well.
Thank you. All right. So tell us a little bit, you had a huge role to play in the hub model, the vaccination clinics. Tell us a little bit about your experiences, obviously, and how the volunteers like Doug and many others contributed to the success of the hub.
Yeah, so certainly, as most people know, we operated 3 hockey hubs across Grey Bruce, really from the beginning of March right through till the end of July. Those sites were in Owen Sound. We moved locations a few times in Owen Sound, and then we were at the P&H Center in Hanover and the Davidson Center in Kincardine as well. And we were running those clinics right through from when the ministry announced we'd start with our immunocompromised and 80 plus, right down to the opening of the clinics to all age groups. So it was quite an experience, a long 4 or 5 months for everyone involved. But I think when most people think about those vaccine hubs, they think a lot about the public health staff that committed their time, the nurses that were immunizing, the other staff that played supporting roles. But on behalf of our organization, we really do need to thank all the volunteers that supported those clinics. Without them, we wouldn't have been able to run, and without those clinics running, we certainly wouldn't have immunized the hundreds of thousands of people that we have and doses given over the last 5 or 6 months. So kudos to all the volunteers, and yeah, I can certainly speak more to the numbers and things as we go along.
So Doug, you're here because you were a volunteer. And I'm wondering what made you volunteer, and tell us a little bit about your experiences, how you felt, what you did as a volunteer, and what was your takeaway from all of this experience?
Well, I volunteered because I really felt that it was important for our community and surrounding area. And, once I worked at the registration desk for one shift, I soon realized how important it was, and the great team that Jason and all the people at Grey Bruce Health had put together. And I just felt that volunteering just kind of helped rally the community around getting to a better place. And I don't think I volunteered for anything more important in my life, to be honest.
Yeah. Were you concerned when you first put your name forward to volunteer? Were you nervous about doing it?
No, I wasn't. I really think, with the masks and screens and everything, the screening process and all those things, and the distance the people were from you, they put every measure in place that could protect the volunteers, which made us all feel safe.
What is your most memorable experience as a volunteer?
I think probably getting to know the nurses and the healthcare workers from all around the region, the retired doctors that you talked to that came back, or retired nurses, or the leads, all those girls, Gabby, Evelyn, Megan, like, you kind of build up relationships with your supervisors, and it kind of turned into kind of a work environment where we tried to make it fun and different things every day when you went there, because they were a lot more stressed out than I was. So I tried to make it fun for them. I did.
Yeah. So you volunteered throughout the whole, how many months, or how did you decide, or how did you even fit volunteering within, everyone leads busy lives. What would you say to people if they were ever asked in the future who said, oh, gee, I don't know if I have time to volunteer?
Well, I think there was a lot of people semi-retired and different people that had a work schedule that allowed them to help. But I found a lot of the volunteers were older, at least they were in Kincardine, and that worked out. So to me personally, it helped my mental health. We've been sitting at home for a year. And then I really believe that helped myself. And I talked to a lot of people about that, and they kind of felt the same way, because, you just be able to talk to 5 or 6 people, your little group, for over a year. And it was really nice to get out. And I know you couldn't come close to them, but you could interact and say hello. And it was really good to see. And you can really see the excitement in the faces and the talk from people that were there getting their vaccine. It was a really positive experience.
Yeah. Having worked as a volunteer here in the Owen Sound area, the most memorable experience for me was the absolute gratitude and joy on the faces of the people coming through the doors saying, thank goodness, it's my turn. And I think I'm hearing you say that as well, Doug.
Yes, for sure. No, that was, it's a learning experience. It's something we never thought we'd go through, but I just can't say enough about the team that organized those hubs and how impressed people were. So kudos to Jason and his staff and all those people. So it was pretty amazing.
How did you decide on the job? Now, I call them jobs, but they're options to choose from as far as volunteering. I don't know if Jason wants to talk about the different roles that volunteers did. And then, Doug, I'd ask you what made you decide to take the role that you did, or did you do several? So, Jason, do you want to describe the roles the volunteers did?
Yeah, sure, Carol. We had 6 main roles that volunteers could sign up for. Some had different requirements in terms of information that was required to be established in those roles. But for non-clinical roles, we had volunteers who were screeners. So those were the folks who were greeting people as they came into the building, make sure they didn't have any COVID symptoms or shouldn't be entering the building for any other reason. We had our navigators, which was our fancy term for kind of traffic controllers. They were directing people through to the various stations throughout. So directing people from screening to registration, taking people from registration and getting them seated in their pods for their vaccination. We had floaters who kind of moved around and relieved people for breaks and did all of the other roles. And then we had cleaners as well. So each time someone vacated a seat after their vaccine, we had to clean that station before someone else could be seated there. So cleaners were definitely busy, a very physically demanding job. So certainly they should be thanked as well. And then in addition to that, we had 2 clinical volunteer roles. So the one Doug mentioned where he was registering people for their vaccine. That was a role that we considered clinical because they were seeing health information of different individuals. So we did require a police check and sign confidentiality waiver for those individuals. And then we also had volunteer vaccinators as well. So as Doug mentioned, retired nurses, physicians, even employed nurses and physicians around their other work and other shifts were coming to support us and giving vaccines at the clinic. So those were our 6 main roles that we had in place.
So, Doug, what made you decide to do the role you did?
Well, to be honest with you, because of some health issues I had, I was going to have trouble being on my feet all day. So we got an email through our council and CEO, Sharon Chambers, that the health board was looking for volunteers. So I filled out the paperwork and handed in my police check and all those things. And I probably could have did some screening, but registration seemed to be a place where they needed some help most of the time. And I tried to fill in, I don't think I missed any days. We could Carden and the odd one and some in the other places too. So that's why.
Yeah. Jason, I have the stats in front of me, and I don't want to test your memory, but you probably have this right off the top of your head. Just how many volunteers there were altogether, and the number of hours, and maybe you can just fill us in to give us a picture of how the community supported the Hockey Hub.
Yeah, for sure, Carol. So we actually used an online self-scheduling software, so people could go into that, fill out their application. When we approved their application, they could start signing up for shifts. So we had over 850 people across Grey Bruce register to be part of the Hockey Hub model and volunteer. Of those, we had more than 500 who actually were volunteers. They had completed at least one shift, which is fantastic. And then of that, we had, well, there were different kind of benchmarks we had, but Doug is one of, I think, a dozen people that had more than 30 shifts completed during the course of the Hockey Hub model. I think Doug was around 45 maybe, and I know there were some that I probably emailed him and asked him to come on short notice that wouldn't be reflected in those numbers. And of those dozen, every one of those folks had close to 200 hours that they supported the Hub. So this was almost a full-time job for many of them. As Doug said, I don't think he missed any shifts in Kincardine, any of the hubs, and he was often in Hanover and would come to Owen Sound as well when we needed him. So that was great. And just to add a little context, when we were running our Hanover hub at full capacity over 10 or 12 hours, we were looking at 3,500 people coming through, and we needed between 75 and 80 volunteers per day to make that model run. So although 500 and some volunteers sounds like a lot, we really needed almost 20% of those on each given day to make the clinic run efficiently. So there was certainly a great need, and the community responded.
Now, the health unit staff for sure were there each time as well, correct? There were always staff there. So the staff often had to leave what would be a normal day's function for them pre-COVID and really focus on COVID-19, the hub.
Correct.
Yeah.
Yes.
So big changes for a lot of people. Doug, that's an amazing story about the number of hours and shifts that you've done. Well done. That's remarkable. Talk about community volunteering at its finest. Well done. So Jason, one of the things you and I chatted about was that what impressed me was the fact that you had done a survey of the volunteers as all of this was going on. Can you talk a little bit about why you did that and what you discovered as a result of that?
Well, as you know, Kara, with any new project, you're learning new things. Probably, I would say every week we learned something new and made changes to each of the hubs on an ongoing basis. But one of the things we did probably about the midway point was just do a bit of a formal survey out to all the volunteers who were approved. So that includes those who had worked at a clinic and those who hadn't, but just to get their feedback about what they were seeing, improvements they suggested. And to be honest, we had some really amazing feedback. Our program evaluator had pages and pages of comments and thoughts. We probably took maybe 15 or 20 of those and were able to make some really quick adjustments, some really positive adjustments, everything from clinic flow to the length of the volunteer shift. Some really just wonderful practical suggestions that we were able to implement and make some really positive changes. So yeah, I really thank the volunteers for being open and honest and sharing their thoughts. They really see these clinics from a different perspective. Being a staff person there every clinic, you kind of just go with the flow, but bringing a fresh set of eyes in for those volunteers was really beneficial. And I do hope that they saw that we tried to implement some changes, and hopefully for the better of everyone involved.
Doug, I didn't actually see your name beside any of these recommendations, but I'm wondering if there was something that you felt had improved as a result of, from the time you started as a volunteer, as you moved through doing the shifts. Anything that came to your mind that you really felt was a big plus for the volunteers?
Yeah, I think the shorter shifts, because I think the ages of the volunteers, and that was a great idea to do that, because I know some people that were a little older were hesitant about signing up for a shorter shift, and once they broke the days into 3 shifts, I know a lot more people felt comfortable that way, and that way, they could sign up for 2 if they wanted. At least they had that option of a shorter 3-hour shift or a 6-hour shift, and there was little adjustments, but to me that was the most important one, and that really showed me that they're listening to the volunteers and working with them, which I thought just really, really helped go in the right direction.
Yeah, and for sure to do a survey and to change things on the fly, because as we were going through all of this and still going through COVID-19, it's always a fluid situation where you're adapting. It's a remarkable thing. Sometimes surveys happen and people later say, gee, really? I wonder what they did with that survey. But Jason, you made changes right away.
Yeah, I think the nice thing, Carol, is we had an internal team that was meeting weekly, so we were always looking at ways to improve those clinics. So once we had those survey results, they were pulled together fairly quickly. We discussed and made some adjustments on the fly, and communicated that back out to our partners. And on top of that, we were meeting weekly with our municipal partners as well. So our partners from Owen Sound, Hanover, and Kincardine, we're meeting with those facility staff as well. So there were discussions happening on multiple levels, and feedback coming from different perspectives as well that we were able to implement.
What do you think will change in the future? Certainly vaccine clinics, whether it's for COVID or for other things, are part of our lives, actually, whether it's a flu clinic or a flu vaccine clinic. Do you think there'll be any changes from the learnings that you've gained from this experience with the Hockey Hub?
Well, I'm not sure, Carol. I hope we never have to go through something like this again to this level, but certainly it looks like we're trending towards this being an annual kind of booster, just very much like the flu. But I would say that from a regional perspective, I think we're ready and armed if we ever need to look at this kind of model again. I think we've gathered a lot of learning, so we would certainly be able to jump to action very quickly should the need arise. We'll continue to run our vaccine program as we have for the flu and all those school-related shots that all the students get, and COVID may be just one that we add to the list.
So, Doug, when you were going through your orientation and your training, how long did it take?
It didn't really take that long. It might have been 30 minutes, but there was, every week or every third day, like Jason said earlier, things changed, about who would qualify, how many days for their second dose, or like just little things that you had emails from COVAX that you had to change, or how you entered something, or, there was always, I'm sure there were all improvements that probably helped, other people calculate how many people, and when the school kids started, you entered what school they were going to, and there was always something. Those COVAX updates were always sent out. I'm not sure who they came from, but I just know they were always helpful. And that way, when you went into the clinic the next day, part of his registration, you had a heads up kind of what had changed.
It was very much trial by fire, Carol. We were throwing our volunteers right into the mix. They'd often Doug probably shadowed one of our staff for 10 or 15 minutes, watched them enter a few people, and then we set him up on his own computer and away he went. And that's very much true of the other volunteers, clinical or not, as well, that the intent was that we would provide a lot of training, but when those clinics are operating at full capacity, it was challenging. So it was really a peer training model. Like if a new navigator came in, I would hand them off to one of the experienced volunteer navigators and they would do the training for me. It was a really great model and lots of support across the board from volunteers and staff. So a lot of volunteers went well above and beyond what they were expected to do and supported other areas as well.
Yes, and certainly there's some real advantages. I know one of the roles I did was the screener, and one of the early learnings early on was that sometimes you needed two or three screeners because you didn't want the lineups. You wanted to keep moving people forward. And it was just to stand there and hear another screener ask the questions, and how they asked the questions was excellent because you were able to learn on the go and modify as needed. So I certainly found that, you like you say, you just had to pick it up, and the goal was to get the people moving through, and that was extremely helpful. Jason, if you had to do it over again, and let's not, okay, once every 100 years, that's too soon. What would you change?
That's a good question. There's probably lots of little things that I would change, or we as an organization would change. I think just trying to be more prepared in advance. I think that's always just easy to say after the fact, but I think we knew certain things were coming down from the ministry, which obviously presented some challenges depending on the amount of lead time you had. But I just think we knew that the vaccines were going to be coming, so maybe to do some preparation further in advance. Locally, I would say our volunteer software that we implemented about a third of the way through the vaccine hubs was a huge time saver. We were doing a lot of outreach individually to our municipal partners, our county partners, to get volunteers initially, and that was just really straining on resources. So when we had our volunteer local software, easy to sign up, easy for people to book their shifts, we just had to go in and input which clinics were running and what times and how long the shifts were, and it was straightforward from there. So yeah, maybe launching that a little sooner would have been helpful as well.
Doug, how did you find accessing the software to book your shifts from the volunteer perspective?
Well, I thought that was just a really good idea, whoever come up with it, because it's just it was so easy. You just clicked on. Within 10 seconds, you had confirmation of your shift, and it was that really made things run smoothly in the signing up part of it. So.
I found one of the strengths as well, when you clicked on the name, whether it was navigator, screener, whatever, it described what the role was. So people would have that to be able to say, yes, I can do that, or no, that doesn't fit with me. So that, it really helped people right away to know, okay, I want to volunteer. What can I do to volunteer? Doug, you mentioned you needed something where you were maybe not on your feet all the time. So you were able to self-select, and that gave people choices. Jason, I'm wondering, how did that software get developed? Was that developed just for Grey Bruce, or did other health units use a similar type of software?
No, we did a little bit of research. This is actually an American-based software program used all across the world. Just seemed to fit what we were looking for. We worked directly with one of their staff, and she was wonderful to help get us set up and running, answered any of our questions. So yeah, it was just a bit of a research project, and then that was the chosen provider.
So not all the same health units. There may have been different providers for different health units.
Yeah, and to be honest, I'm not sure exactly how other health units were addressing their volunteer recruitment. It worked for us. I'm not sure how others went about that.
Yeah. Certainly the tool was extremely helpful, and it was helpful as well because if the shifts were all filled, it told people the shift is filled, so that you could either choose a different shift if you were available, and you could plan ahead because it wasn't just for one day. Am I right, Doug? Does that ring a bell for you as well?
Oh, yes, yep. Yeah, when you went on there, for sure, it lets you know that, which is good, and let you know how many shifts were left. You could communicate that to friends that were thinking of signing up, which, you know, you knew if they were short, and I'm sure there was lots of people out there doing the same, you know, letting people know that we needed some more volunteers.
Did you have people talk to you, Doug, about volunteering and wondering if they should? Did you recruit volunteers?
Yeah, I did. I recruited a few. Yeah, I did recruit a few. Yeah, I did. You know, I just thought it was, you know, like I said at the start, it's really important, you know, for Ontario, but it's important for our community and for us to get back to normal. And we have some amazing volunteers in this area, and just to communicate with them that there's a lot of different job descriptions that they could do. And, you know, most of the ones that I talked to did sign up.
So I'm hoping our producer will let us know how much time we have left in the segment. That's a hint to the producer, because I could be chatting about the volunteer experience on and on and on. Jason, what will happen now as we head into fall? What do you anticipate? There will be vaccine clinics that are going to be moving forward into the schools.
Yeah, that's correct. So our hockey hubs are all closed down. They finished at the end of July. They're all cleaned up, and that space has been given back to the municipality. All those supplies we're keeping close at hand. Most have come back to the health unit, been packed up, and are being stored at Chapman should we need them. For this month, the month of September, we have mobile clinics running until the end of the month. So in different communities, little pop-ups for 2 or 3 hours as people see the need. And then we're also, as you say, engaging with our school boards and offering clinics within the schools for all the students who are eligible. And that is ongoing as far as I know at this point.
So you've packed up the supplies and stored them at Chapman's, who's been an amazing support as well for our community, and basically hoping never to need them again, but they're available should they need to be. So
correct, yep.
You're anticipating at this point that the volunteer involvement will not be required, that it...
Yeah, that's correct. Once we wrapped up the hockey hubs with the mobile clinics, our staff are pretty self-sufficient. It's usually a drive-in or a drive-up type model, so there isn't the need for all the volunteers to do the screening or directing. I should say, Carol, that the municipalities as well provided a lot of parking volunteers. So before we close, just wanted to say that too. We didn't organize them, so I haven't really referenced them as much, but there were a large number of parking volunteers in Kincardine and Hanover specifically that really helped traffic flow outdoors. So they were certainly part of the big picture as well.
Well, I believe our time is almost up. I want to thank both of you. Doug, thank you. And Jason, as always, it's great to chat with you. Thank you for what you do to help our community. And I want to thank our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Take care, stay safe. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Are you the type who would keep going or stop? It's not easy to stop when you have an addiction. Legalizing cannabis won't stop addiction. It trivializes its consumption. Let's be vigilant. If you need help, visit portage.ca.
I'm Wendell Clark with a word about winning. We all know it takes a team effort in any sport and with any challenge. You can be a part of the winning team that shuts out and